Good evening, everybody. My name is Dr. Ajay. I'm a cardiologist at St. Francis Hospital. I came to this country about 10 years back to start my training at the Cook County Hospital in Chicago, which is basically a safety net public hospital which focuses on providing care to the underprivileged, irrespective of insurance, immigration status, etc. My training there made me acutely aware of the subject of healthcare disparity. This subject, unfortunately, has followed me to Tulsa as well. This is a slide from the Tulsa Health Department which basically points out a sobering statistic. A child born in North Tulsa today will live 10.5 years less than a kid born in South Tulsa. I think this is a number which should give us all a moment of pause. Why is that so? Why this big a gap? From a socioeconomic perspective, there are multiple reasons which are out of the scope of this discussion. But from a medical perspective, let's make it a bit more granular. The issue of healthcare disparity was exacerbated even more when COVID struck. As this slide from the CDC points out, hospitalizations and deaths were twice more likely in minority communities. As you're all aware, the folks who suffer the most from COVID, who die the most, are the ones with underlying chronic conditions, which again are far more prevalent in minority communities. So what are these chronic diseases? This slide from the American College of Lifestyle Medicine sums up the gravity of the issue. Chronic diseases or lifestyle diseases are obesity, heart disease, cancer, diabetes, stroke, dementia. A staggering 6 in 10 Americans have a chronic disease. 4 in 10 Americans have 2 or more chronic diseases, and half of all Americans have heart disease. Now keep in mind, these numbers are way worse in minority populations, and that's one of the main reasons for those last 10 years that we talked about, as well as the disproportionately increased mortality from COVID. But there's good news. Most of these diseases are the result of just 3 factors: a poor diet, lack of exercise, and smoking. All 3 of which are more prevalent in minority communities. And the solution is addressing these factors in a holistic way rather than simply throwing pills and procedures. Addressing the root cause, closing that overflowing faucet rather than simply mopping the floor. Lifestyle medicine is the newest branch of medicine which tries to treat lifestyle diseases with lifestyle measures, the so-called 6 pillars of lifestyle medicine, which are a healthful eating pattern, increasing physical activity, developing stress management strategies to manage stress better with yoga, mindfulness, meditation, forming and maintaining relationships, improving your sleep, as well as cessation of tobacco. I'm in the process of starting a program at my hospital wherein about 10 to 15 patients would come together in a group and would be taught various aspects of lifestyle medicine. However, I realized that ironically, this program at the hospital will not address the people who need it the most. And similar to my alma mater, the Cook County Hospital, I wanted everyone to have access to this program, irrespective of insurance status, immigration, etc. And that brings me to my Thrive project. The program I envision is free for all, a 2 to 3 hour session once a month to begin with, in an informal group format, where I bring together like-minded, passionate individuals. For example, I would have someone who would talk about stress management, mindfulness, meditation techniques, a simple teaching kitchen where folks would be taught to cook simple, healthier dishes, cooking healthy on food stamps, for example, making healthier choices at the local grocery store, how to read food labels better. I would have someone talk about the benefits of exercise and connect them with resources for exercise, which might be the local Y. Similarly, I hope to have someone discuss addiction issues, be it smoking, alcohol, or drugs, all in all a program which addresses the 6 pillars of lifestyle medicine that we talked about. Because when you make the lifestyle of a family healthier, you basically change the trajectory of that family. And those healthy changes have a ripple effect on the friends of that family and the community they live in. Through Leadership Tulsa, I've been able to connect with some incredible people who I think would be critical to making this program successful. Now, this is a saying that's attributed to the father of medicine, Hippocrates, about 2,500 years back, and this cannot be more prescient and appropriate with what we're seeing with COVID these days. I want to end by thanking the folks at Leadership Tulsa, Marcia, Michelle, for the incredible learning experience that Thrive has been. Thank you for mentoring us, helping us make those connections, which are so vital to the products that we're pursuing, for helping us meet some incredible people as part of this journey. And above all, thank you to my class for all the support that you've given to all of us. You guys really are the best, and I wish you all the best for all the projects that you're pursuing. This is my email address and my cell number. If you have any questions about this project or anything else that I can help with, please feel free to mail me or call me on my cell number. Thank you very much. All the very best and have a good evening.
I always forget, like the sort of the role healthcare plays in every issue that especially in Thrive, that you learn about. So that was again a very useful reminder. Now, hopefully, we will hear from Dr. Joseph himself. Are you with us?
Yes, I am. Sorry about
Hello.
that. There was some bit of a snafu here.
Listen. This is live streaming. This is how it works.
Yes.
It's okay.
And beside, your video was playing. Nobody even knew that
That's right. Yeah.
that anything was going on.
They know now, but they didn't know
Yes.
before. So why this issue? Why Tulsa? Why now?
Yeah, yeah. I did my training at Chicago, and the Cook County Hospital is a hospital which is basically whoever goes through that hospital, who trains at that hospital, calls it the 3 best years of their medical training, because you get to see the whole plethora of disease processes as well. Besides not just disease process, you see the socioeconomic aspect of that as well. And that's what basically changed the way I look at disease, because you cannot be just focusing on just pills and procedures. You got to look at the foundation, what's causing that. And that healthcare disparities and healthcare inequities has been my passion since I trained at the Cook County Hospital there. And when I came here about 3 years back, after I finished my training and all that, obviously when that was still in my I just wanted to do something about it, and I just started to do some bit of my research, and what I found was just absolutely stunning. I mean, as I pointed out in my slide, I mean, the fact that you have a 10.5-year difference in life expectancy between 2 areas in the same city, that's just not good. That's just not good. So that was a sobering statistic. And then of course the last year and a half, it's just been everybody's been affected by COVID. And I'm sure we all know, it's the folks who have all these underlying conditions who die, who are the most risk. And that this past 1 year has just made it even just exemplified the whole issue. So yeah, that's why now, better late than never.
Well, you talked a lot about what lifestyle medicine is, and it is a growing discipline.
Right.
So what about it can have a powerful impact on this problem?
Oh yes. So diabetes, obesity, blood pressure, heart disease, they're all basically, there's no reason why. There's absolutely no reason why folks should have blockages in their heart. There's no reason. I mean, if we follow the right things, it's a lifestyle disease. It's purely a lifestyle disease. And the same goes for diabetes as well. A lot of diabetes, some of it is of course genetic, but about 95% of that is literally purely related to our lifestyle. So if you think about it, if you compare folks who just a simple study of there was a study that they did in Europe where they compared folks who exercise, not Europe, in California, in the Kaiser Permanente healthcare system. So they compare these folks who walked or exercised half an hour compared to the folks who did not, and the mortality from COVID was staggering. Was about 5 times more in the folks who just exercised half an hour. So just think about it. Just exercising half an hour decreased your chances of dying, because you're healthier, your lungs are healthier, you're lesser at risk for getting problems when you get sick. So those 5 aspects of 6 pillars of lifestyle medicine, each of them have such a critical role when you talk about health, when you talk about COVID, be it just COVID, be it diabetes, be it everything. So yeah, there's just so much to talk about on that aspect itself. But yeah, this 1 year, if you learned anything, it's just keep being healthy, just by doing simple things like exercising and eating healthy. It makes it's a big difference when it comes to outcomes from COVID.
Well, and we're running a little short on time, but can you tell us how people can help out with your project, can partner with you and support you?
Well, yeah, as part of LT, I mean, leadership of this class, I've had a chance to meet with some really awesome people who I think are going to be incredibly useful for my projects, especially Katie Plahaki. I've talked with her, and she's somebody who might want to work with. Meg, who's part of my cohort, who's going to be, who I'm hoping to connect with. So I do have I've been able to lay the foundation stones for that matter, for this thing, and I'm hoping to get some support from my hospital as well. There have been some leadership changes in my hospital, and the new leadership is looking at this in a very positive way. So I'm hoping for things to start off quite soon in the next few months.
Well, Dr. Joseph, thank you for joining us on this live stream, and we wish you nothing but the best in this incredibly important project. So thank you.
Thank you very much.